Again, you always begin a PNF technique with the rhythmic initiation. Okay. Now, again, as Todd was mentioning, though, there's PNF techniques that we were used for stretching. There's PNF techniques we were used for strengthening. All right. So, more of your hold, relax, contract, relax type things, you may be better suited when you're doing that for strengthening. Our slow reversal and agonist reversal we're looking at more when stretching for the first. I'm sorry, did I say strengthening?
You did.
I'm sorry. So hold and contract, relax more for stretching. And in strengthening purposes, you're going to look at slow reversal and agonist reversal. Okay? But with rhythmic initiation, again, I want to passively take them through the pattern that I want them to end up producing. Okay? And those who are true gurus in PNF, they make sure that you are demonstrating that pattern effectively and in the appropriate pattern and with a functional pattern, a proprioceptive neuromuscular facilitation pattern, you're crossing midline. All right, that makes it more functional. You're not just staying on one half of the body. All right. Now, again, with this, as Todd has already mentioned in some of the other techniques, if you have someone that may be more sensitive to personal areas, you may want to use a barrier with some of these techniques. All right. Just to be able to make sure you're respecting their privacy and all as well. But it too depends on how you're actually doing and performing the actual techniques too. Okay. So what we'll do, usually I like them to be close towards the edge of the table. All right. I'll put my arm underneath. Okay. So my hand is then going to be at inferior angle. All right. And then I'm having her relax and trying to keep her in a neutral position though. Because if I allow her just to flop over, then she maybe go into a protracted position. Okay? So you want to make sure you try to maintain a neutral position. So the first technique you're looking at with the scapula is you're going to do an anterior elevation and a posterior depression. Alright? So what we do is we have her make sure that they are aligned where ears going through the tip of the acromion and then we're lined up with the hip then as well. If I have her way out of alignment and then a lot of flexion, cervical flexion, I'm already putting undue stress on the traps then, and it's going to create a faulty movement pattern. All right. So I want to make sure that they are lined up with each other. All right. Now I'm going to use this ear as my guide. So when I'm doing an anterior elevation, I'm taking her shoulder, and it is actually going to just anterior to that ear. Okay? And then posterior depression, I'm now thinking again, we've already talked about depression going to the opposite buttock. And that's what we're kind of looking for. So we're taking the scapula down into that posterior position, posterior depressed position towards the opposite buttock. So now we've crossed midline as we're doing this. Okay? And again, so
look at how much motion she has too, because I think a lot of you are actually trying to put the scapula in the back pocket and it's not going to go.
Exactly.
So watch the small motion that you're actually going through.
So as we're doing this, and they need to be completely relaxed. Yeah, that's all right. I'm not going to hurt you, I promise. So you're just guiding them. I want you, when we do this, you're going to be coming here, just in front of your ear, and then we're going back down. Now again, the depression part, we're not going to go as far into the depression. All right. And if I push too much, look at the strain I already placed on that upper trap. You can see fibers begin, as they lengthen, they're sticking out at me. And that's not something I'm going to keep cranking on. Okay? So a few times I'm going to take her here. I'm taking her through that motion so she can feel it, and I'm kind of feeling the quality of that motion as well. It's very important, though, that you keep it, and sometimes I confuse people when I say this, but I like the clock idea myself, and some of the stuff that I've read, it's based on a clock too. So 12 o'clock being the ear, 6 o'clock being the hip. We're the hands. Okay? I want to take her, if I'm on her left side, I'm taking her to 11. Okay? And then down to 5. I don't want to go 9 to 3. You want to stay tight in that particular motion, in that pattern. So again, I come here a couple times now. You feel like you have that pattern?
Maybe.
Maybe. Now I want you to start doing it with me some. Just go ahead and now I'm kind of as I'm here, I'm making sure she's still going into the correct areas, but I'm also kind of gauging, is she getting the correct contraction on this, okay? That's the great thing about this. You're getting these manual cues, tactile cues. Now, do you think you can do this on your own?
Sure. Probably not down or up.
So now, so immediately, as soon as she begins doing this on, you saw, she probably went between 9 and 10. Okay? That is not the correct pattern that we're trying to facilitate. All right?